Hello everyone, my name is Sherifat Abdusalam. Today I'll be performing deep tendon reflex assessment video. I have my school attire on, my badge, no nail polish, no jewelry. I also have here with me my volunteer, Mohammed.
Consent to the video.
Right. So what I'm going to do first is to verify the physician's order, gather my supply. Today I'll be using the reflex hammer. Then I'm going to proceed and go to the patient's room, knock, enter, provide privacy. I will introduce myself to the patient. My name is Sherifat. I'll be your nurse today. And then I'll identify the patient 2 ways. Can you tell me your name and date of birth?
My name is Mohammed. My date of birth is 02041970.
Okay. I will also verify that with a wristband. Then I'll proceed to explain the procedure to the patient. Mr. Mohammed, I'm here to perform the deep tendon reflex assessment. This is normally performed on pregnant women. It's a neurological evaluation in preeclampsia that will help us determine whether the patient is hyperreflexia or whether they have clonus, and it also helps to monitor patient for magnesium sulfate toxicity. Do you have any questions for me?
No.
All right, so the way this process works is I'm going to use your tendon muscles on your bicep, your tricep, your patella, and your Achilles. I'm going to use that for this assessment. I'm also going to do an ankle clonus to check. The rating for this is 0 to 4, 0 being absent reflex, 1 being hyperactive, 2 being normal, 3 being brisk hyperactive, and 4 being hyperactive with clonus. And then what normally happens is if the patient have 3 plus and above, that means the patient is hyperreflexia and they are at risk for preeclampsia. For the clonus, if it's positive, that means the patient is at risk for seizure. Also, it's also, like I mentioned, help us to check for magnesium sulfate toxicity for patients that are being administered the medication. So to start you said you give me consent to start the process. To start, I'm going to use the pointed edge. I'm going to have the patient flex their hand. I'm going to put my thumb to locate the bicep. Then I'm going to use the pointed edge to hit the patient's hand. And that's normal. Next thing I'm going to do is locate the tricep. Same thing, use my thumb to guide and locate the tricep, and I'll use the pointed side of the hammer. And that one is also normal. Next thing I'm going to do, I'm going to check the patient's leg. Can you dangle your leg for me? I'm going to check the patella, and the way I'm going to do this is to use the patient's kneecap and locate the end of the kneecap, and I'll use the flat side of the hammer to, all right, that is also normal. Then for the Achilles, I'm going to just flex the patient's leg. I'm going to just use the flat side of the hammer and hit. So I feel the reflex on my hand, that is normal. The other thing I'm going to test is the ankle clonus, and for this one, I'll still just flex the patient's feet to see. So once I drop my hand and the patient drop their feet, that is normal. But if I notice 3 to more twitches before they drop their feet, that shows that the patient is positive for clonus, which put them at risk for seizure. Mohammed, this is the end of the assessment. All the deep tendon reflex came out normal. Do you have any question for me?
No.
All right, so patient, no question. I'm going to make sure patient is back in a comfortable position. Place the call light beside the patient. I'll also gather my supply, which I have in my hand. I'll leave the patient's room, provide privacy. I'll remove my gloves, perform hand hygiene, and document. Thank you.